being here. We're going to move to our last presentation. And the two folks here are unbelievable partners to work with. Kim and I have been connecting recently on some stuff, and I just feel like there's a lot of opportunity and potential for our agencies with outreach, and I think that she's doing amazing work. And I would love if you would give a little plug on your new mental health service piece at the end today. But to start off, let me start by introducing Kim Gonzales. Kim is the Executive Director of the Los Animas County's District Health Department. District Health Department, where she has served in various capacities for 21 years, and the Director for the last 10 years. Since 2016, she has led efforts to provide programs and resources focused on substance use disorder and opioid use disorder in the community. Her dedication to public health continues to drive innovative and compassionate approaches to care and prevention. Also with her today is Taylor Torres. She is the Health Department registered nurse. Taylor serves as the BSN registered nurse for Los Angeles County's District Health Department. She is dedicated to promoting community health through outreach and education with a strong commitment to public service. She strives to make a meaningful impact on the health and well-being of the communities they serve. Kim, I'll turn the floor over to you.
Is this on? Do I have to turn this on?
It should be on already.
Can you guys hear me?
Yeah.
Okay. Okay, well, thank you all for having us. We're going to just go through some data slides first. On what drives us to do the work we do with public health. So here is a graph that indicates overdose death rates, any drug on the board as compared to the state of Colorado. You'll see Los Animas and Torres County are consistently higher than the state rate both before and after COVID. So I know that this morning that was a question as to data, the before and after of COVID, of our data books between our two communities. And you can see we are still higher. And so that's why we do the work we do and continue to change with the landscapes of our communities. And so you'll see the rate in red, it's higher than the state rate. I think this is an impactful illustration for how to understand how our rural communities are disproportionately impacted by issues like overdose. So back in, I believe it was 2017, I presented the same information to a legislative roundtable here in Los Animas County and at a winter conference for CCI for county commissioners. And now I feel like we're back here again presenting the same data that we still have a lot of change to do going forward. And so here this slide illustrates emergency room visits where overdoses were cited as the reason for patients' visits. The rate of ED visits in Los Animas County is almost exactly twice as high as the state average. So you can also see that the pre and post COVID, there were a slight increases in ED visits for both counts and in rates. Next slide. Oh, so this is the slide I was just talking about, sorry.
Okay.
I'm looking at a different one. So here you can see, again, we still are still high. You know, you're down about 10 between two counties, but we're still high. So we still have a lot of work. Next slide. Here, go back one, sorry. According to the Centers of
Just a little bit too for the people online.
What's that?
We need you just to speak up just a little bit for the people online. Thank you.
According to the Centers of Disease Control, total overdose deaths in the state of Colorado have dropped from 1,998 to 1,637 between December 2022 and November of 2024. An 18.1% decrease. Opioid-related deaths saw an even sharper decline of 28.5%. And fentanyl-involved deaths fell 35.1% from 1,238 to 804. The Attorney General Weiser attributes this to the decline to having Narcan fully accessible to our communities. And I'll let Taylor take over.
So what is Narcan? Narcan is the brand name for Naloxone. It's a medication that rapidly reduces opioid overdoses. So the way it works is it's an opioid antagonist. It blocks the opioid receptors and restores normal breathing. It can be given through a nasal spray or an injection. The time it takes to work is usually about 2 to 3 minutes. So how opioids affect the body. Opioids bind to the receptors in the brain, causing feelings like euphoria, pain relief, and it also slows breathing. In high doses, respiration, depression can lead to death. So signs of opioid overdose. So it varies, but it could be pinpoint pupils, unconsciousness, slow or shallow breathing, pale skin, sometimes the skin can look gray as well, blue or purple lips, snoring, or even like gurgling noises with their breathing. Next slide. So how Narcan is administered. So you're going to want to lay the person flat on their back. You want to see, if you can call their name or see if they're awake. You want to tilt their head back, that way you can open their airway. You're going to want to hold the Narcan. It looks like this. It's very user-friendly. So you'll just put this part inside their nostril, and on the bottom there's a little button, and you'll just push that into their nostril. And then as soon as you give it, you always want to call 911 and roll them onto their side to prevent nausea, vomiting. If it does not work within 2 to 3 minutes, you can give it again. They cannot overdose on Narcan, so you can give it as many times as you need until medics arrive every 2 to 3 minutes. Once you give it, it usually stays in the system from anywhere to 30 to 90 minutes. Next slide. So after it's administered, like I was saying earlier, how you want to roll them onto their side just to prevent choking in case they throw up. The person can wake up agitated or confused, so you want to make sure that you stay with them until EMS arrives. You can also be prepared to give CPR if needed, if they aren't breathing. Oftentimes, you might need a second dose, as I was saying earlier. Some people might even need more than that. Next slide. And this is what a box of Narcan looks like. And there's 2 doses here in this one. Yes?
If Narcan is administered and not on drug, it's not harmful?
No.
Okay.
No. Yeah. So Narcan will not work on drugs that aren't opioids. So it's not going to work on cocaine, marijuana, methamphetamine. It will not work on those. But if you give it and they are on that, it will not hurt them. Next slide. Or yeah, this slide. So Good Samaritan law protects people who give people Narcan. You can't get in trouble for giving it, for trying to save a life. And so you're protected from arrest when you give it for drug possession, paraphernalia, or even underage drinking. Some people that think that they'll get in trouble for calling, but you won't if another person is overdosing. Some people get scared of that, but giving Narcan can save someone's life.
I have a question.
Yes.
If you get to the person and they're not breathing, can you still use that?
Yes. Yes, you can. Because it will help restore their breathing and reverse that opioid overdose. Yes?
How many doses are in each?
This, 2.
No, not in the box, in the thing.
1.
So you use it once and then you have to use a new one.
Yes.
Thank you.
Your job as the role of a bystander, you want to recognize that there's an emergency. Oh, I'm sorry, next slide. You want to recognize that there's an emergency. You want to stay calm and try to act as quickly as possible and call for help. Administer Narcan and give rescue breaths if you're comfortable giving CPR if needed. Next slide. So Narcan, this is just an overview of when and why we use it. So it's a medication, as we said before, that rapidly reverses opioid overdose by restoring normal breathing. When to use it? If you suspect someone is experiencing an opioid overdose, even if you're unsure, you can still use it. Why use Narcan? It can restore breathing and consciousness in people who have overdosed, potentially saving their life. Suspected overdose, so you want to look for signs, as we explained before, unconsciousness, slow breathing, pinpoint pupils. You want to try to act as quickly as possible and not hesitate. Acting is better than hesitating or not acting at all. Narcan saves lives, so using it in a timely manner can definitely save someone's life from an overdose. Next slide. Don't do this one. So these are different types of opioids. So as you see, the natural ones, there's morphine, narcotics, codeine, there's a few on there that I cannot pronounce. And then the second one are the semi-synthetic ones. So these are naturally occurring opioids which have undergone minor chemical processing. So heroin, oxycodone, hydrocodone, hydromorphone, buprenorphine, and then there's your synthetic ones. So there's fentanyl, tramadol, methadone, different types of fentanyl. There are over 100 types of prescription opioids. The most common ones prescribed. So it would be like Vicodin, oxycodone, Percocet, oxymorphone, morphine, codeine, fentanyl, and hydromorphone, as well as methadone. Next slide. So where can we get Narcan? So here in Los Animas County, as well as Warfano, we do give them for free at the health department. Keep Trinidad Safe gives it as well, and Walmart and Safeway, but I believe you have to pay for it at Walmart and Safeway. So we do give it for free at the health department.
So just to touch back on the pharmacies with Safeway and Walmart, they do have a standing order in place through CDPHE. And if you have Medicaid or Medicare, it's a small copay, if not free, if you get it through the pharmacy. And they do like to see Narcan go home with anybody who does have a prescription for narcotics. So it is a shared prescription usually when you are picking up those type of prescriptions.
Next slide, please. So storing Narcan. So you want to store it room temperature if possible. You don't want to have it in an area that's too hot or too cold. And you want to avoid prolonged exposure outside. You want to keep it away from direct sunlight and excessive light exposure. Packing and storing. So you want to store it in the original package that it comes in, and you want to place it in a safe place that's easily accessible for an emergency. And you always want to make sure that you check expiration dates.
Can it still work if it's expired? So kind of like EpiPens?
Yeah, it can, but it might not be as potent
Sure.
as normal. Yeah, but expired is better than nothing.
Sure. Thank you.
You're welcome. Next slide.
Okay, so are there any more questions on Narcan before we go into this next section?
I was just gonna say one thing with the expired, medical facilities are not allowed to give that out, but I'll take it, because I would rather use expired than nothing, so at ATS will take it.
Oh,
Yes.
oh, Amanda has a question.
Can you use Narcan on an infant?
Yes,
Yes.
you can.
So I just want to tell a quick story before I go into this next part. So back in 2017, I believe it was, we worked with the Colorado Consortium, and Jessica Eady came and did Narcan presentations and trainings, and she brought her dog with her. It was so stigmatized at that time, but we were the first in the county to start offering trainings and giving out Narcan for free. We sent everybody home with Narcan during those trainings. Because of the stigmatization of Narcan, she actually administered it on her dog in front of everybody. So that is actually how safe Narcan is. We could administer it right here to each other and it's not going to affect us. So just to kind of destigmatize the usage of Narcan.
We have a couple of online questions as well.
Okay.
So is it true that a recipient of Narcan can experience withdrawal symptoms immediately after being revived?
They can wake up agitated. So yeah, it's gonna reverse their high, I guess you want to say. So I don't know if it's necessarily withdrawal, but they can wake up agitated, confused, have symptoms like that.
How would you recommend a bystander respond if someone is agitated as a result of withdrawal?
Just try to stay as calm as possible and neutralize it until EMS arrives.
Can anyone go to the health department to get it?
Absolutely.
And then, if Dr. Beverly, how can I get Narcan for my office in Trinidad and Walsenburg? Do I just go to the health department and ask for it?
Yes, you can, and she can even speak to our supervisor. I know that there's a way that she could sign up to get it sent to her facility for free.
It looks like, as of right now, that is the last, as far as questions online. Anybody else in the room have questions? Go ahead, the microphone.
Yes?
So I know we've seen videos and in other trainings they talk about, and they talked about it earlier, how like fentanyl can be absorbed through the skin, stuff like that. So is there like any way to protect yourself if somebody has that on them and you go to like save, and like give them the Narcan, but then you come in contact, like, or can you just talk about that a little bit?
Like if you were to get exposed to it?
Right.
I'm not too sure on that one. I mean, you don't want to give it to yourself if you don't know if you're overdosing or not. How would I?
So generally speaking, so in the past, there were a lot of reports coming out saying that first responders were overdosing from touching fentanyl, and they just touched it with their hand and they overdosed. Those reports were proven false. So if it's aerosolized and you're inhaling a fentanyl that has become aerosolized, there is a concern there. They have since shown that just touching fentanyl with your hand, or not fentanyl, but like if you're out and you touch someone who used fentanyl with your hand, you will not overdose. Still wash your hands afterwards. Don't touch your eyes, put your fingers in your mouth, because you never know. So follow normal like hygiene things. But the reports that came out, there was a lot of stuff coming out. There was a lot of stigma, and those reports were proven false multiple times.
Other questions?
Any other questions?
Check online here.
Has there ever been an allergic reaction?
Not that I'm aware of. Not that it's never been reported to us at the health department that there has. But I mean, there could always be a possibility of that. But not that I'm aware of.
So far, that's it online.
Thank you.
Okay, so we'll go into some additional efforts and prevention that we do at the health department, just to give you guys a little bit of an idea as where our work is going in prevention, education, support, and our response to the opioid crisis. So at the health department, we're actively addressing the opioid crisis through a comprehensive strategy grounded for prevention, education, and support. We do community health assessments every 5 years to understand where we're at in our communities. Those then build our 5-year public health improvement plans and guide us in the work that we do with whether it's substance use, SUD, OUD, or this last community health assessment identified social isolation as a key indicator for us to work on. It identified mental health and substance use. Back in 2018, it was identified substance use and mental health. So we're still seeing these key indicators. And so we then build our public health improvement plans to work with our partners to look in our communities to see how we can tackle these going forward. So together, these efforts form a coordinated and community-centered response aiming to reduce our opioid misuse and its devastating impacts. So first, about in 2016, next slide, we started, we started. Judge Gerbach and Marty Maloff started a coalition. It was the Partners for a Drug-Free Community. Judge Gerbach was seeing so many individuals in her courts, in the community, on the streets, and gathered all of us professionals together and said, let's do something about this. And so that is actually how we have Partners for a Drug-Free Community today. The health department took it over a few years ago to keep it sustainable. So it's been going for 9 years, and I credit Judge Gerbach for getting that for us in our community. So with that, we were witnessing increased impacts of substance use, both inside and outside. So over the past years, we have led the Drug Task Force with a strategic plan tackling the opioid epidemic. So we look as a group and we meet regularly to discuss state and local efforts, share resources, and develop community strategies to reduce substance use and support those in recovery. If you're interested in attending any of these coalition meetings, please reach out to Marcy or I, and we can get you on those monthly meetings with us. We do a lot of great work. Next slide. So at the health department, we look at systems change initiatives and how we can embed those harm reduction strategies into everyday community infrastructure, increasing access in saving lives and reducing stigma around substance use, for example, Narcan. We are partners with Colorado Department of Public Health and Environment through the Colorado Naloxone Bulk Fund. We also work with Dr. Schrader, who's part of the Narcan project. And so we are able to provide free Narcan to the community, no questions asked, and we provide training. People can come as many times as needed. It's not a one and done. So please, if you know anybody that needs it, we ask that you send them to us. We would like to see this in all first aid kits for individuals going forward, because we're not just stigmatizing those who are using and identified as substance users. This could be a grandparent that forgets that they took an opioid and takes another one and overdoses in the home. So keep Narcan in a first aid kit. A lot of people keep them in their carry bags or their cars, just in case they see something on the streets. But we are trying to destigmatize Narcan, include it in our first aid boxes at home. We also offer medication lock boxes at the health department. This is something we started, I believe, 4 years ago. And so we distribute these to help community members secure the prescription medications to reduce the misuse, and especially among children and teens, to support those safe disposal practices as well. We partner with CDPHE for fentanyl test strips. As part of a harm reduction approach, we provide these along with training and education on how to use them. They're free at no cost. So if you'd like to have some within your departments, please let us know. And then we have worked with school districts and county buildings and city buildings over the past 2 years as well in helping change out their first aid boxes on their walls that have like the AEDs, the different kits inside them. So now those kits do include Narcan kits. Again, to try and destigmatize that Narcan is available everywhere. Our goal is to have Narcan accessible, practical, and rooted in the real life environments of the environment we serve. So just trying to normalize it. Next slide. Again, system change and partnerships. We have life skills facilitators in school districts in both Los Animas and Huerfano counties, working with the Bonfins curriculum that is evidence-based and teaches youth essential skills for resisting peer pressure, making healthy choices, and building resilience. We've also added in the YSL program, which is a bullying program, because we're noticing that in a lot of schools as well. We have an anti-stigma campaign that we've been working with Claudia Murra on she's an assistant professor of research at the University College of Nursing and School of Public Health. And that is to help destigmatize mental health and substance use as well. So on your tables, there are coasters and pens that have an image of the posters that we put in the community. There's a QR code on those coasters that will link you to the health department website for individuals for resources and information. We are continuing to change the material because the drugs change in our communities. And so we are working on updating our campaign right now to include fentanyl and changing some of what our images are, as we are now working with youth to help us create these images. They're culturally sensitive to both Los Animas and Huerfano County, as this has been a big project for the Partners for a Drug-Free Community partnership as well. They helped create this campaign, and we'll continue to work on evolving new material and creating toolkits for businesses, schools, and our lay community to be able to use this toolkit within their own businesses going forward. So we're hoping to have that done by the end of this year. We are using students from the university. They'll be here at Santa Fe Trail Days to do some data, collect some data for this campaign as well. So if you see them down there at Santa Fe Trail Days at a booth, please stop by and look at the material and take the surveys. We, in the past, have done the New Start program through judicial probation and crossroads with Vivitrol, and we've worked with Lana Geyer as being the medical professional on staff with Dr. Tenery as well as Dr. Carlisle, in offering individuals Vivitrol during their treatment and recovery, and those were identified through the court systems and then handed off to us at the health department. And then we also have done family learning events, and we'll continue to do those to myth bust substance use and opioid use as well as mental health. We like to give families practical tools and resources and peer support information. And so we did one last year. It was well perceived during this time. We learned a lot on what not to do and what to do with these youth and families. So going forward, please look for those family events and please attend them if you can. Next slide. This is a poster of the anti-stigma campaign. This image was created by a youth. And so we try to include what is created locally and what is impactful to our communities. And next slide. Okay, continuing on with systems change and partnerships. We work with our WIC department on the pregnancy, postpartum, and substance use program and education. That our WIC program, which is Women, Infant, and Children, touches those individuals that are 0 to 5. And so this is a great place to partner and have that system level change effort, instilled in the public health system. We offer HIV, Hep C, and STI, which is sexually transmitted disease testing within the health department. We offer education and treatment for the individual and their partners. And so we are really trying to ramp up that going forward. We've received some additional funding to do that. We also have worked with medical assisted treatment programs and behavioral health in identifying individuals and giving them the resources to go to recovery or seek treatment across the 2 communities, as well as including Pueblo and Otero County. We push out 988 posters and brochures, and as well as many educational pamphlets like you'll see in the hallway out there on the little mesh thing. And next slide. And so what's new? And this is what's exciting. That's why the fun image on there. We have a youth advisory council that we are looking for youth and a behavioral health program. Next slide. So the Youth Advisory Council, we are looking for individuals that are 12 and older that are in high schools between both counties, Huerfano and Los Animas County. Our idea is to have 2 youth from each school district to be part of this youth leadership council that we want to form. And so we would like over the summer, we're hoping to have these youth and create and do workshops with them on leadership and how to build them as leaders in the community, public speaking, because ideally we would like to take them to city council and county commissioner meetings to have the youth voice, to participate in youth groups going forward, so that we're building community for our next generations and generations after that. I think, in public health, we see changes. We don't see instant changes, but we see changes 5, 10, 15 years down the road. So what better way is to start with our youth and change the trajectory with our youth and the paths that they're seeing in their homes and their schools going forward. So if you know any youth, we do have information at the table in the back. There's a QR code that they can sign up and there's an application form. Reach out to Marcy or myself or Taylor and we can get you connected. Our goal is to have, about 30 youth on board with us and have a conversation. Next slide. And then I'll end it with probably the most exciting thing we just started May 1st. It's Mental Health Awareness Month is May. And so the health department over the years, and a passion of mine being in public health is integrating mental health with public health, reducing stigma, and figuring out a way that we can reach individuals at all aspects of their life. And so May 1st, we started a mental health program through the health department in both Los Animas and Huerfano County. It is not just for individuals in one, substance use or just for individuals for families. It can be for youth, children, and adults. We have 6 providers on board. We are also working with Latinx company who is working with our Spanish-speaking population, and they have many more providers as well to help us out. We have also partnered with CAMP, which is through Farm Bureau. They already offer 6 free sessions of mental health support for the ag-based community. So we partnered with them, and if an individual is identified through CAMP, they'll get the 6 free sessions through them. The next 4 are on the health department to equal that 10 free sessions. If they qualify through iMatters, which is the youth program from the state of Colorado, that is youth up to 21, I believe. It's 6 free sessions. We pick up the next 4 free sessions for free. If they don't qualify or have any payer source, the 10 sessions are free. This is a no wrong door mental health program. It is telehealth, so there's 3 different ways to access our providers. You can come into the health department and have a safe space at either Trinidad or Walsenburg and be able to meet your provider online with them. If you have a youth that is seeking mental health, we have sensory tables and sensory buckets and tools for them to do their mental health services. If you have the availability in your home, you can do it in your home for free. If you don't have technology and don't want to do it within the health department, we will check out tablets and jetpacks for those individuals to be able to do it in a safe place that they feel outside of the health departments. Anybody can sign up. You can go to our website at the health department and connect that way. You can call either health department and our front desk receptionist will get you connected. This is something that we had to look outside the box at. We know we lack resources in both communities. We don't have enough providers. We know at the health department we cannot sustain to pay for providers within the health department. So we reached out to the Colorado Trust and said, let us think outside the box and figure out a tool for our communities that'll benefit all and not just one population and demographic. So we were able to start this program. It took a lot of thinking and figuring out how we were going to work this and how we were going to get providers. And we thought we would kick this off in April, but it took a lot of work. So May 1st, we kicked it off. Within 7 days, we had 3 participants in Los Animas and 4 in Horfano County. So it's exciting. And so this is what Michael was talking about is our new and upcoming program. And so if you have any questions, let us know. We're always trying to think of ways to help and bring programs and be sustainable in our communities. So please join us in conversations at the coalitions with our youth councils. Give us a call, give us an email. We're always open to conversations and how we can make things better or see if we can, add things to what we do. Thank you.
Okay, are there any questions in the room?
Sometimes here on campus, we'll have students from other states or even out of the country. Would they be able to access those kinds of services?
Absolutely, because at that time they're a resident of our community, so we would welcome that.
So say they start using like iMatter or Camp or whoever they go with virtually, right? And then you end up picking the final 4 or however many sessions. Would they get to keep working with the therapist that they were already working with, or would they have to switch to whoever you guys are utilizing?
So the goal is to keep them with the same therapist. And so the goal is, and the exciting part is the individuals get to pick their providers as well. So if you see, there's some packets out there. We have the bios of all of our providers. And so if they're not a good fit for that provider, the provider will let them know and move them to seek another provider or help that transition. If they do have Medicaid, Medicare, or private insurance after the 10 sessions, they can keep going with that provider, or they can fall back into the voucher system with us. Because we know that a lot of providers do not accept the private insurance because of the billing process with that. And so that's where we're willing to keep that process going. And we also know that 6 sessions isn't enough. That barely gets to the stem of the problem, if at all. So that's why we wanted to do 10. And then if the individuals need to keep going and don't have a resource, then we'll continue to work with them with our voucher system. I forgot to say too, another thing is we are also the fiscal agent for the peer mentors with probation in our IOG group, Interagency of Oversight. And so if you know any peer mentors that are looking for work, reach out to Marty Moloff. He's gonna love me. Right? Because there is work available for them if they are in a certain position in their recovery as well.
Let me check one more time online.
Done? Okay. We have one more presenter today, and I'm going to check in with Shannon. We're a little ahead. Do you want to break now and come back at normal, or would you like to start?
Yeah, let's break now. Restroom, cooking break for 3 minutes.
Three? Okay. So we'll take about a 15-minute break for those online using with us, and we will be back for our final presentation.